Hello, I'm Dr. Lennie Bazira, Policy Director with the Community Health Impact Coalition CHIC. I care about community health workers, and that's why I have used my leadership journey with WomenLift Health to throw a spotlight on why they need to be professionalized. I care about this because millions of community health workers are not salaried, skilled to provide no supply. 70% are women. This is a dual-sided human and labor rights issue in that community health workers are exploited and the services they provide are less effective for their patients. Despite many declarations since 1978 with Alma Ata, there has been little or no action toward professionalizing community health workers. To change policies that support community health workers needs a dual strategy that includes grassroots engagement led by the community health workers, top-down approach that is multi-sectoral and needs political commitment. An assessment carried out by CHIC, we found out that only 35 out of 91 low-middle income countries had policies in place that support at least one group of community health workers to be accredited and salaried. Unfortunately, Uganda, my focus country for this project and where I come from, was not among the 35. In Uganda, community health workers are referred to as village health teams or VHTs. First responders for all health issues, including pandemic response. They face a lot of challenges in that they are not paid. They have no adequate transport or lighting, face stockouts, and personal safety and security issues. The policy expired in 2020 and is yet to be updated. To empower the community health workers, we have to look at this. Why should we empower them? Because people closest to the problem have the best solutions. And nothing about us without us is what community health workers say, and I fully support them. So they should be in any room where issues concerning community health workers are being discussed. And with supported leadership training, they are 2 to 4 times more likely to engage in civic and political advocacy for their rights. And so, from the grassroots level, I embarked on supporting community health workers in Uganda to undertake the CHIC advocacy course, organize them into a national association, and look for CHIC members to lead a national NGO coalition so that together they can engage with the government and other stakeholders to influence policy change and review. We have been able to realize some gains in the country in that hundreds of community health workers have undertaken advocacy course and are organizing into a national association. We have offered a 2-year fellowship program for one of them to be as an organizer, and she was awarded the Heroine of Health 2023 and co-authored a paper with myself throwing a spotlight on the challenges faced by community health workers because of lack of policies in place. The Ministry of Health has recognized advocacy course as part of the official curriculum. I have a woman mentee, NGO leader in Uganda I'm working with on the NGO collaboration mobilization. And together, we are supporting the community health workers to register their national association, to influence the government policy review so that it can be supportive of the community health workers, and finalizing guidelines so that the efforts in Uganda can be replicated in other countries that needs the professionalized community health workers. As I co-journeyed on this leadership journey, I looked back over my years in global health, and I wondered, a woman in the US like myself, you have qualifications aligned to your profession, paid for the work that I do with full employer benefits. I have mastered the challenges of working on global health, including travel and caregiving and motherhood. On the other side, a woman in Uganda doesn't have standardized training, also works tirelessly but with no pay or benefits, and balances motherhood, caregiving, embodying resilience in the face of challenges. So both work, they should be paid, and they need supportive institutional practices for success, emphasizing the need for pro-CHW policies. I care, and I hope you care too. So let us advocate for the professionalization of community health workers and for fair pay. This will ensure that we fight for equality for women in global health, including community health workers. Whether you work with the government, donor, corporate, NGO, or academia, You rely on community health worker to have the impact that you need to improve healthcare outcomes. So together, let us make professional community health workers the norm worldwide. Thank you, WomenLift Health, for this opportunity. Thank you, CHIC, for your support, my woman NGO mentee, thousands of community health workers who serve tirelessly despite the challenges, my family for your love and support, and to you all for your attention and listening to me. I welcome your questions. God bless you.